is Mitchley from South Africa. I'd like to thank everybody at the ALA for inviting me here and for the hospitality and interest they have shown during my trip. It's been my first trip to Australia, and I'm enjoying it very much. So this morning I'd like to chat a little bit about the mechanistic, beyond a mechanistic approach to healing, and that's something that everybody here, I believe, is familiar with, because everybody I've seen does that anyway. So it's taken from the angle of what we do, which is coherent multi-radiance therapy. And part of our journey at Radiant Life Technologies, it was started by Teon Mares, who was a visionary and author of 7 books, and he came up with the concept of CoMra therapy. And part of the overall idea is to encourage holistic self-sufficiency and to help people to help themselves. So that's the motivating force, and our philosophy is that we would like to encourage people to take responsibility for their health, happiness and well-being, and this is one of the ways we do that. We have also our CEO runs courses on relationships, and that is also part of what we do, to teach people more about how to relate to themselves better and their relationships with the whole of life. So it's an ongoing process for us. What does CoMra therapy do? CoMra therapy supports the body in its natural intelligence and stimulates it to do that which it is most competent to do, to heal itself. The device provides an impetus for a healing action to the organism and delivers to the organism a message to initiate the healing process. The basis of CoMra therapy consists of 5 main principles. We define these as: life is a regenerative process, life is one interconnected whole, life is a gentle, natural evolutionary process, life is a self-sufficient and self-sustaining unto itself, and intent is the one and only pervasive force sustaining all of life. Using the principle of correspondences, these principles are embedded in our device too. The way in which they are transmitted is through the coherent impact of 4 low-frequency laser, ultrasound, magnetic field, and the 4 main colors. All of these act as a one whole to achieve the process of communication with the body, and this information simultaneously initiates an energetic impetus to the organism to begin the process of healing. Most importantly, CoMra therapy does not interfere in the work of the body. In other words, it is not trying to tell the body what to do, but instead assists it in its natural activity by preparing the body to allow internal processes to take place in an environment that is supportive of their development. Gradually, the body becomes more balanced, and as a result of this, the necessary adjustments in the person's way of life also take place. In practice, this encourages lifestyle modifications and the gradual transition to patterns that are more consistent with the true inner needs of the person. The delta laser is not like allopathic medicine. It rather acts as a mediator that balances our physical body again in a way that favors and supports the process of being fully aware and responsive to everything that happens in and around us. Let's look at the 5 principles one by one. One of the conceptions of allopathic medicine is that the body is a very complex machine that inevitably breaks down. So, for example, osteoarthritis, the cartilage irreversibly wears with age. But that's not true. We have evidence now that cartilage can regrow. In Russia, they've done studies to show that over a period of 2 years, you can regenerate cartilage using laser light. And the truth is, as I've said, that the body constantly regenerates itself. As you know, that there are many, we replace our cells every moment of the day. We're constantly regenerating. So, looking at CoMra in the light of the first principle, life is a regenerative process, we see that in the arts of healing, it supports the healer within, And in terms of medical technology, CoMra is meeting the needs of diseased cells through an energetic stimulus, a healing message, and a mechanical impetus. One of the findings nowadays is that diseased cells lack energy, and we have short-term stress, leads to impairment of function. Repetitive stress leads to structural damage and chronic diseases, and critical stress and lack of energy leads to cell death. Looking at the more technical side now, the magnetic field, they have discovered, stimulates ATP production in cells. And we see that in the presence of the 25 magnetic isotope is 240% more efficient than the other isotopes. And an external magnetic field can further increase efficiency by 50 to 80%. And this again shows that Russian research shows that red infrared laser stimulates the ATP production in cells, and you can see through the graph there, time after irradiation from 10 minutes, it peaks and then goes down again after 30-40 minutes. So cells need messengers what to do, and this is part of the equation as well. We see hormones giving messages and local mediators giving messages to the cells. Stem cells also need messengers to grow. We have a test here where there's week 1, no messengers and no growth in a cell in vitro. Week 1, chemical messengers, growth factors were added to stimulate the growth of cells. And in this particular Petri dish, there was added infrared light, and that is shown to also stimulate growth in cells. So we see here chemical messengers and infrared light, and you'll see the growth through the infrared light more than equal to that from chemical messengers. Color, as you know too, can act as a messenger through the nervous system, and so color is incorporated with the LED lights. Red stimulates the sympathetic nervous system, fight or flight response. Indigo violet stimulates the parasympathetic nervous system, rest and digest response. And yellow-green stimulates and promotes physiological balance. Cells also need to transform molecules for biosynthesis or biodegradation. And we see that ultrasound increases the speed of enzymatic reactions, and that's one of the roles of ultrasound. The other roles of ultrasound and magnetism are just to help put the cells in a more coherent state, and when there's disease, the cells are in an unstructured form, and with the addition of magnetism or low-intensity ultrasound, then they can rearrange themselves more and become more coherent. A conception, again, of allopathic medicine is that disease can be cured by treating isolated organ or chemical processes. That obviously leads to negative side effects and an epidemic of chronic and incurable diseases. The second principle is life is one interconnected whole. In terms of the arts of healing, this means a holistic approach to healing. We don't treat the individual part, we treat the whole being. And in terms of medical technology, we have this synergy of the 4 radiances in CoMra therapy and local as well as systemic stimulation. So it's not just a localized application. In terms of the proof of energy, the synergy of light and magnetism in ATP synthesis, they were shown that light of 500 milliwatt per square centimeters is equivalent to light of 50 milliwatts per square centimeters plus a magnetic field of 35 millitesla. So,
Charles, what is ATP?
adenosine triphosphate. It's one of the building blocks of the cells. So we have the synergistic stimulation of key processes in any type of cell tissue. So we see on the right-hand side color LEDs and infrared laser, magnetic field, and ultrasound work together to have an effect on metabolism, ATP synthesis, and neurochemical messaging. Most people are familiar with the use of laser for localized treatments, and so if you go to a physiotherapist or someone like that, they will, with a sore back or a sore knee, they will get out their laser or ultrasound machine and they will apply it to your knee or your sore back, and that's the end of the matter. With CoMra therapy, based on sort of a lot of Russian technology, we treat the organs, the skin, the blood, the nervous system, and the endocrine system. So you'll see on the diagram on the right of one of the treatments that we're not just treating the liver, for example, we're treating the other organs, we're treating the femoral artery, we're treating the carotid arteries, and the central nervous system through the back, as well as the kidneys. So there's a combined approach to treating most conditions. So again, allopathic medicine will look at the fact that broken chemistry or organs must be forcefully fixed or replaced. That leads to no long-term solution and is very expensive. Principle of life number 3. Life is a gentle, natural process of evolution. In terms of the arts of healing, we have the Hippocratic Oath, and firstly, do no harm. In terms of the medical technology, we have low-intensity, non-invasive radiances, which work equally to or better. Benefits are 0 negative side effects, safe for pregnant women, newborns, and elderly, and safe even after prolonged usage daily. With a lot of the physiotherapist types of lasers, which are much stronger, then they are very dose dependent, and so you have to be very careful that you do not overdose your patient. Whereas with CoMra therapy, because we're dealing with levels of 5 milliwatts and 10 milliwatts, they are so low that you cannot possibly overtreat. From allopathic medicine, a patient's health depends on drugs, money, and experts. Drug dependency, no access to affordable health care, and obviously we have the corruption in big pharma. The only way to truly empower others is to help them to help themselves. Then we have principle of life number 4. Life is self-sufficient and self-sustaining unto itself. In terms of the arts of healing, the body knows best how to heal itself. We only need to support it with knowledge, warmth, and care. In terms of our medical technology, it is easy to use, versatile, and a safe device. This is another example of treatments, a systemic approach. We have a cardiology treatment, for example, that treats a wide range of heart conditions, and we treat, again, a wide area. In terms of the allopathic model, we have the human being is a victim of genes, environment, and society. That leads to a belief that they are powerless, no hope, and giving up. Principle of life number 5. Intent is the one and only pervasive force sustaining all of life. We translate that in terms of the arts of healing into a person must take responsibility for his own health, and in terms of our medical technology, empowering individuals in creating health, joy, and quality of life. Focusing for the moment on the doctor-patient relationship. They speak different languages. Patients usually want a quick removal of their symptoms and to return to their normal old lifestyle. But this is exactly where the problem started, otherwise they would not have become ill in the first place. In practical terms, therefore, the doctor neither really heals nor is the patient really cured. The cause of the disease is not addressed, but instead the only work is done on the elimination and suppression of the symptoms in a manner that interferes with the functions of the body, and therefore the diseases keep recurring. In one way, however, this fully meets the desires of the patient. as she wants to remove the symptoms, but not the causes. And this is how and why allopathic medicine satisfies his or her desire. However, we are working towards a new medicine and a new doctor-patient relationship, and this is founded on the new attitude of man towards his own health. The main factor in maintaining health, regardless of the method of healing, is for people to assume responsibility for their own health. This is the first step in unlocking the healing process. Our device is a necessary mediator and a complementary tool that simultaneously helps doctors as well as patients to make the required changes in their awareness and so to change. The doctors are in no way excluded from the process. On the contrary, and they are encouraged to develop and enrich the therapy, and doctors agree how different it is when they interact with people who take responsibility for their own health instead of transferring it to someone else. Looking now more onto sort of CoMra therapy and the technicalities itself, what is CoMra therapy? Coherent multi-radiance. It comprises an infrared laser at 980 nanometers, and we also have a model of 905 nanometers. This is strangely more powerful, even though there's a small difference, and it's mainly because we believe that it's up to 6 times less absorbed in water, but it has a much more powerful effect and is generally used by professionals as well as people who have bigger animals, such as horses. It also has color LEDs, 3 different colors and frequencies. Red at 650 nanometers, yellow green 570, indigo violet 420. And they are set up in a specific sequencing arrangement that gives a message of regeneration to the body. There's magnetism at 30 millitesla and ultrasound at 40 kilohertz. Again, it's compared with normal physiotherapy ultrasound, it's very low level. They deal in sort of the megahertz types of strength. And that's how it looks on the delta laser, the infrared laser in the middle, the LED lights around the edge, the ultrasound buried beneath those plastic platings in the middle, and the magnets are hidden in the near to the LED lights. Origins. Low-level laser was originally developed in the 1960s, and research and proof of efficacy mainly has been carried out in Russia. It's established worldwide, but most of the research is in Russian, and they've done far more research in Russia than they have really anywhere else in the world. They were the first people also to develop a combined type of therapy called MIL therapy, magnetic infrared laser therapy, which combined infrared laser with magnetism and red LED light. That was established in the 1990s, and in fact in Russia this technology has become so well adopted that it's part of state medicine and is used in state hospitals. We have a clinic in Russia, and our director of research is Russian, and our device has also been approved for use in Russian hospitals, and so it's quite normal there. He went to a conference in Moscow, and it was a trade show and conference about these devices, and there are about 20 or 30 different producers of multi-radiance type of devices. So over there, it's very well established, although they don't generally include ultrasound in what they are doing. Because CoMra therapy supports the body's self-healing ability, most illnesses and injuries can be treated. And systemic treatments will combine irradiation of blood, blood arterial points, for example, the lymphatic system, central nervous system, direct support for organs, and sometimes acupuncture points as well. Just talking a little about these fundamental treatments, as they are quite important. Blood irradiation was pioneered in Russia and was often used as a monotherapy. In those early days, they would insert a probe into your vein, and then they would put light through the probe into your vein. They realized after a while that it didn't have to be so invasive because low-level laser does penetrate through to the skin anyway. So this one fundamental treatment strengthens the immune system. It increases the oxygen carrying capacity of the blood. It helps the little red blood cells to bend more easily to fit into the capillaries. And it's shown to have a regenerating effect on mitosis stimulation and a biostimulation stimulating effect on the cell membrane. In fact, there's a whole list of benefits of blood irradiation. Somatic biostimulation. This supports the body through actions on the heart, the thymus gland, the central nervous system, and the adrenal glands. So we find with this treatment, for example, it's another fundamental treatment, that one of the first things that people with chronic illnesses say is that, well, I've had the best sleep I've had for months or even years after just one or two treatments with this. Similarly, it's very balancing as well. It puts the body into what we call an activation state, and that encourages the body to heal itself. Other benefits, for example, include balancing of hormones. Clients have had, who've been going through menopause, have said that they don't have hot flushes and are far more balanced. Clients who are psychotic and have got bipolar disorder have also said that they are far more balanced and do not have to take their sleeping medication to sleep at night. So, yeah, through balancing the system, there are an enormous number of benefits. Moving on to the LEDs, the light from the color light-emitting diodes is fully absorbed by the skin and provides a healing message to skin-embedded sensory nerves. Since our skin represents the body's largest organ, possessing vital immune and endocrine functions, LED irradiation of skin also initiates local and systemic responses to disease through chemical messengers, cytokines, and hormones. Ultrasound gently stimulates metabolism through increase of molecular transport and temperature, speeding up processes of protein synthesis and degradation that are crucial for restoring damaged tissues. And here again we see the diagram of the coherent effect on different aspects of the organism. Again, one of the areas that people don't know very much about is the aspect of helping to encourage bone density. So you see on the case study on the right, quite a remarkable improvement in bone density during the course of a year. Other aspects include normal aspects for laser therapy, including traumatic injuries, tendinopathy, arthritis, low back pain, neck pain, trigeminal neuralgia, fibromyalgia, diabetic neuropathy, and a whole range more. In terms of the other benefits, many people also use low-level laser therapy for recuperation and getting themselves into shape for sports use. So we have better performance, less muscle fatigue, better ability to compensate for oxygen deficiency, and more strength. Also, there's delaying muscle fatigue and enhancing muscle performance, quicker recuperation after max or exercise or in between, and decreases skeletal muscle damage and inflammation. Just to start on one at the moment, this is an example of a Czech Olympic athlete who says, during the summer vacation, my body temperature suddenly increased and I felt an unbearable pain in the area of the left hip. Doctors diagnosed me with Staphylococcus aureus in the blood and inflammation of the hip joint. A week of hospitalization followed, relieving the joint and applying an antibiotic treatment which removed the Staphylococcus from the blood approximately. 14 days after the onset of symptoms, I began applying the delta laser every day. After 3 weeks of treatment, my hip joint range restored to 90% and hip pain subsided. It allowed me to avoid taking medications to control the pain, and energy kept restoring throughout my whole body. My personal experience with the delta laser is currently the most positive and most intense of all resources I've had the opportunity to use for rehabilitation and regeneration during my professional athletic career. That's a similar one for rib and a rib disease, a broken rib. We're running out of time, so we wanted to just continue on to a different topic that's a similar topic that is part of what we are involved with as well and what we're bringing. And it is to do with EMF, radiation, and water. Water is the most fundamental element in sustaining life and makes up more than 2/3 of our body mass. The water in our bodies is structured and is called liquid crystalline water because of the contact of water with proteins, the building blocks in our body, and the effect of the natural biofield we have, as well as the magnetic field of our planet. The structured water is the universal medium for all the processes in our body, from the movement of muscles and the lubrication and suspension of joints to the neurosignal transmissions. The electrical signal travels outside of the neurons within the medium of the structured water that envelops them. As you know, blood is also a fluid and, like water, is affected by magnetic fields, especially due to the fact that there is a high content of iron within the blood. The delicate and structured order of the water in our body is also easily damaged by stress and especially by cell phone and wireless radiation. Cellular phones, wireless networking, digital communications, RFID, TV broadcasts, and satellite transmissions all contribute to an enormous background of erratic electromagnetic radiation at high frequencies, or electropollution, electrosmog for short. The quality and freshness of water plays a vital role in our body's general health. And from Dr. Mu Shik-yun, all water is not created equal, and it is the structure of water within our bodies that ultimately determines health or sickness. What can we do about this? The technology we have has been invented to tackle two problems simultaneously by combining the absorption of the surrounding electromagnetic radiation and then using this absorbed energy to increase the quality, structure, and energetic level of the water we consume and within the human body. The absorbed power is transformed to generate a safe and a beneficial signature to restructure water. 7-layer micro device. There's more detail on the leaflet outside about the technology in this, but essentially a 7-layer micro device utilizes the science of electromagnetism and a knowledge of the molecular structure and dynamics of water to provide the benefits. In terms of the wireless protection, we found that it absorbs on average 25% of the wireless radiation from your cell phone, Wi-Fi, and other equipment. On the website, if you're interested, evolvinginnovation.com, you'll find measurements and research relating to cell phone radiation absorption, microwave signature measurements, magnetic nuclear resonance measurements, and dissolved oxygen measurements that all show a little bit more about the technology and how it works and the results we've obtained so far. To conclude, I'd just like to show a little bit of a short 2-minute video from the States, from an ophthalmic practitioner there, who, as eye therapy and eye conditions are also something that seem to be of great interest to people. And it's something that a lot of people suffer from, and this may also help to show. This is Dr. Larry Wallace from the States. He's an ophthalmologist and past president of the College of Syntonic Optometry.
We had a vitreous detachment, that is the fluid in the eye of a patient pulled loose and detached inside the eye, which is a normal aging process, except it held on to the macula. And so in the macular area, it pulled the tissue off the center of the eye and created a hole, and that hole filled up full of fluid. That's called a macular hole. And so we used delta laser. First we did some other things, got no results. Again, we went to the delta laser only, and I added the ultrasound. In fact, I talked to the surgeon. The patient was seeing an ophthalmologist also, and I told him, what do you think about using ultrasound on her eye? And he said, I never heard of such a thing, but I don't know. He said, maybe. I said, well, because it won't release. He was talking about injecting an enzyme in the eye to melt away the membrane so that it would release and the macular hole would shrink down. But there's risks with that. And so anyway, he was very conservative, which was good. He'd bring her back and check. But the hole just wasn't going away. And that's when I said, well, how about the ultrasound? He said, I never heard of such a thing. I said, well, if I use low amounts, do you think it's risky? He said, well, I don't know. But I don't think so. I don't know. So we added the ultrasound. Wow. It shook free. The ultrasound added to it. The membrane released. The hole closed. They went back. We got photos. The hole's gone. He couldn't believe it. That was like a month later.
Yeah. Thank you. Just to finish, just wanted to mention that we have ongoing courses for people who are CoMra practitioners or also advanced home users who want to learn more. And they're generally run online over a period of about 6 weeks. And so they're it's a structured learning program. And out of that, we're developing a CoMra community. So they're a community of people who are regular communicating. We have an online platform that people can communicate. They can share their questions. They can share their discoveries. And it just helps people to get together and to speak to each other a little bit more. And if you don't mind, Deirdre, I'd like to mention you. There's one of our CoMra community members at the back, Deirdre, and she's done quite a lot of the courses, and she'll be happy, I'm sure, to talk to people and to mention a little bit about her experience in terms of the courses and her experience with CoMra as well. Thank you, Deirdre. The other thing is on Monday from 10 o'clock till about 12:45, we have a demonstration and a live interaction in the room number 2 next door. So if you'd like to come along to that, please come along on Monday morning. It's 10 to 11:45, about 1.5. We can go on for longer, perhaps, if people want. But yeah, thank you very much indeed for being here and for listening.